Physical health and fitness for older women. Understanding why physical activity is important as we age and how to maintain an active lifestyle. Common problems as we age. These problems can be reduced or avoided by increasing physical activity. There are many common physical problems as we age. These include chronic diseases such as heart disease, cancer, chronic bronchitis and emphysema, stroke, diabetes, and Alzheimer's disease. These chronic diseases can be caused by high blood pressure and high cholesterol. And in addition to these chronic diseases, older people are more at risk for falls, which are the leading cause of traumatic injury in this age group, which can be directly related to decreasing motor control and flexibility. There is also an increased risk for depression, as well as the incidence of declining cognitive function and dementia. In order to evaluate the learning needs in the community, you need to have an assessment survey for the women 6 years and older in each planning and service area. You need to discuss what are the resources for promoting physical activity in this community, what are the most pressing health needs for the women in this community, what are the barriers to participating in physical activity, and what support systems are available for women engaging in physical activity. The resources: people need more transportation for the elderly. Health needs are increasing in healthy diet and physical activity. There are barriers such as no transportation, feel of being tired or injured, and lack of support from family and friends, and community groups and hospital-supported groups and independent living facilities as means of support for these people. The model of health promotion that was used was the Pre-Seed-Proceed model. This is a community-involved model which makes it a more viable option for finding the needs of the community and leading the change that you need. Phases 1, 2, and 3. Phase 1 is a social assessment phase, where the community is assessed as to what they perceive their needs to be. Phase 2 is the epidemiological phase, as well as the environmental and behavioral assessment phases. These are behaviors or environmental factors that need to change. Phase 3 is the educational and organizational assessments, which find the supporting factors or barriers to the first two assessment phases. Phase 4 and 5. Phase 4, administration and policy assessment, which is the internal and external workings that can promote or hinder the intervention, which includes any monetary needs that may be addressed. Phase 5, implementing the planned intervention. Phase 6 is the evaluation phase. This includes 3 types of evaluations: plan evaluation, impact evaluation, and outcome evaluation. The Health Promotion and Education Plan includes a community goal that elderly women in the community will increase their physical activity to increase their overall health. Behavior objective number 1 is that the elderly women in the community will utilize the classes and physical activities available at the Wellness Center and other facilities every week. Using a media campaign in the community to advertise the availability of the classes will help promote awareness to these women, as well as having a variety of programs for physical activity. Behavior objective number 2 is that elderly women in the community will use the public transportation methods available to travel to the physical activities locally. Providing a safe and reliable means of transportation to the facilities and events, hosting programs and classes for the elderly women is another way to promote participation in physical activity. Behavior objective number 3 is that the elderly women in the community will seek professional counseling for any concerns they may have regarding their physical activities and related health. Having a nurse available at the community centers and scheduled events to discuss any topics or questions that the women might have regarding their health is important. This will promote comfort and trust in the community and increase the likelihood that the women will continue their physical activity plan. Research and evidence shows that increasing physical activity decreases cardiac issues. It is recommended that healthy older individuals exercise 3 to 5 days per week for 20 to 40 minutes each time. This may be intermittent or continuous, with a minimum of 10-minute sessions of moderate aerobic activity. The types of suggested activity are walking, running, jogging, cycling, or swimming. Blood pressure, serum lipid levels, and blood coagulability all benefit from exercise. Increasing physical activity also improves mood. Physical activity in a group has been found to increase mood in elderly women. Evidence also shows that exercise facilitates self-efficacy, which may also be a reason for enhanced mood in the elderly female population. By having social interaction and better fitness, the older population is more likely to suffer less depression than those who are isolated and sedentary. Increasing physical activity is beneficial for cognitive function. It has been shown that having a lifestyle that is physically active shows a decreased risk of cognitive decline in old age, and that physical activity is directly related to better cognition and processing speed. It also may have beneficial properties for memory. To evaluate the effectiveness of the teaching in this community, a quantitative method should be used, such as keeping track of the number of individuals who attend the physical activities and their health progress, which would include vital signs, lab work, and a general feeling of wellness. To conclude, research has showed that physical activity is a prevention measure for avoiding disease and injury. It was also mentioned that less than 60% of older adults engage in physical activity and strength training. Integrating community programs for older women is an important aspect to the general health of the aging population, which is increasing each year. Not only are physical things better, if the community health programs can decrease falls and hospitalizations, it would be an economic benefit as well as a health benefit.